On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Hey, good evening, everyone. Yay, we're back together again. Hi, thank you so much for joining. I'm Dr. Donna White-Carey. I am the host of Talking with Dr. Donna, and I am so happy to be back with Season 3. Can we clap it up? Season 3. Wow. It's amazing. God is good, and I am so happy to be able to be here as your trusted messenger to deliver to you information that hopefully is important to you and your family. And that most importantly, not only will you just listen and hear it, but you'll actually share it with someone and you will use the information. So thank you so much for being here again. For those of you who may not have joined in our previous seasons, you have an appointment every Thursday with the doctor at 6:30 p.m. And we are live so that you can interact with me and I can with you as well. And then we can chat during the show. You can let me know if you have any questions and I'll be happy to try to answer them for you. If I don't have the answer tonight, I'm not going to guess. I won't just make up an answer. I'll go research it for you and give it back to you during the week. So thanks again for coming and being here. If you are not already a subscriber, what I would really appreciate it is if you go to my YouTube channel, if you're watching this on Facebook or any other thing other than YouTube, that you subscribe. So you go to my YouTube channel, Talking with Dr. Donna, hit that red subscribe button and then that little bell icon right next to it so that you get notified every single time we go live. And when do we go live again? Every Thursday at 6:30 p.m. you have an appointment. So who's out there tonight? Hi, Cherise. Hi, Auntie Janella. Bridget, Emery, I see you. Hi, Annette. I see you all. Thank you so much for joining again tonight. So how did you guys like my new theme music? What do you guys think? I had to give a shout out to my niece, Brittany Walters, for creating the sound for that intro. Yeah, there's talent in the White family, I tell you. So thank you to my niece for that music. I love it. It's upbeat, and so thank you. Let me know how you like it. Put a comment in the chat section. Give Brittany a shout out. Let her know how you liked the music. And if you need something done, maybe she'll do it for you too. I don't know. That's a family gift. I don't know. Hey everybody, thanks for shouting out and saying hi and giving some love to my niece Brittany. All right, so here we are, September, season 3 of Talking with Dr. Donna. We are here because our mission, why are we here? Why do I even have this YouTube channel? And I have this YouTube channel because I want to build generational health, the network. And our mission is to end the cycle of premature death in Black communities here in America and across the diaspora. If you know anything about the health of Blacks in America and across the diaspora, you know that we have the highest mortality rates in almost every disease category: cardiovascular disease, diabetes, cancers. We may not have the highest rate of infection or the highest rate of what we call incidence. That means we may not have the biggest numbers, but when you look at who dies the most in those disease categories, it is Blacks. So my job here tonight is to give you some information that you will take away, that you will use to help end the cycle of premature death in our community. We have 4 pillars of generational health that we look at. We look at our spiritual pillar, our emotional and mental health pillar, a physical pillar, and an environmental pillar. So we really look at those 4 pillars of health, because I firmly believe if we look at those 4 pillars of health, we can then make an impact on the health for generations to come. You know, it only takes one change with you right now. Then if you have a child, that change for the better in you and your health can last for 4 generations. That's amazing, right? So again, take what you're learning tonight for these next 30 minutes, not a long time. These next 30 minutes, I really want you to pay attention and get something that you can use not just for yourself, but for your family, and share what you're learning here with others. So share the YouTube post when we post it, share the information, let people know they can come on and keep their appointment every Thursday with Talking with Dr. Donna. All right? All right. So this month in September, there's a couple of things we're celebrating this month. I know we're in the middle of the month and you may not have already been celebrating, but we are celebrating Latinx Heritage Month. So we are giving a shout out to our brown brothers and sisters. And you know, we say Latinx, there's a lot of Black communities in the Latin community, right? We're kind of joined here. If you look at a number of, you know, the whole transatlantic slave trade, Latin countries have a whole lot of African influences and an African in their blood. So we're going to shout out our brown and Black brothers and sisters and give a shout out to Latinx Heritage Month. So shout out to all of my Latin brothers and sisters. And then also in September, we are celebrating Sickle-Cell Disease Awareness Month. And this is an important month because this is the only disease that is genetic, that is inherited predominantly by Blacks, okay? Throughout, again, the world, predominantly Blacks. So we are going to make sure that you are aware of sickle cell disease. The color for sickle cell disease is red, so we are wearing red to honor all of those who are battling sickle cell. We are giving and paying honor to, we lost maybe 2 that I know of in this past week here in the Bay Area of sickle cell disease. A young girl, young folks are still passing away from this disease. A dear colleague of mine's sister is hospitalized as we speak right now with sickle cell disease. We have family members and church members who have sickle cell disease. So we know that it's out there, and I know that you probably know someone who has sickle cell disease too. My cousin, Eric, my first cousin, is the first person that I knew who had sickle cell disease, and who I even remember as a young child thinking about, well, what is sickle cell disease? And feeling confused because he was in the hospital a lot and not really understanding what the disease was, what that meant. What did that mean for me? If he's related to me, does that mean that I can get it too? Lots of confusion, lots of questions. And so I always remember what I remember most about my cousin Eric as a child. He's still with us, thank God. He's doing well. But what I remember the most is that we were always very nervous about whether or not he was going to make it when he went into the hospital. And I am thankful today that my cousin is well into his 50s and is thriving and doing well. So shout out to you, my cousin Eric. And so we're going to talk a little bit with one of my actually little sisters. So it's hard to believe that she's my little sister, but she is. We went to UCLA together, and she was kind of, I guess I adopted her as my little sister. And now she is a full-grown, awesome physician scientist, has her own lab. Like, you guys probably don't even understand how amazing that is to have your own lab, that she has other scientists below her, and her specialty and focus is on sickle cell disease. So I'm going to tell you a little bit about my little sister, and then I'm going to show you a video of our interview where we talk about sickle cell disease. Then we're going to come back and hopefully kind of go through some questions if you still have them. So let me introduce you to Courtney Fitzhugh. That's our show for tonight. It's in the genes, because that's what sickle cell disease is, impacts the genes. And so we're going to learn about it from Dr. Courtney Fitzhugh. She got her Bachelor's of Science magna cum laude from University of Los Angeles, UCLA, and then her medical doctorate degree from UCSF here in the Bay Area. Then she went on to participate in a NIH clinical research training program where she studied under Dr. John Tisdale. And then after receiving her medical doctorate degree, Dr. Fitzhugh completed a joint residency in internal medicine and pediatrics. So see, my influence was still there, Courtney. So internal medicine, that is the physician as adult medicine, and then pediatrics, of course, is for children, which makes sense that she was able to combine those two residencies to do what she does today. She came back to NIH in 2007 and was appointed as an assistant clinical investigator. And then she was made a Lasker Clinical Research Scholar and now is on the clinical tenure track investigator since 2016. She's a member of the American Society of Hematology and the American Society of Transplant and Cellular Therapy. And you're going to see how all of that and all of that training comes together to introduce us and help us to not just understand what sickle cell disease is, but better than that, treat it, and in some cases, cure it. So let's listen to Dr. Courtney Fitzhugh. Let's welcome Dr. Fitzhugh to Talking with Dr. Donna. Welcome, Dr. Fitzhugh.
Thank you very much for having me.
This is such an important topic for the Black community, and I'm so happy that you're here tonight as our expert to talk about sickle cell anemia. So let's start with, what is sickle cell anemia?
Sickle cell anemia is a disease that some people are born with. It impacts red blood cells. So the red blood cells are the cells that carry oxygen throughout our body to deliver it to the different organs like the kidneys, the brain, the liver. And normally those red blood cells are shaped like a donut, and they easily move throughout the blood vessels because they can squish easily. But with sickle cell disease, those donut-shaped cells turn into a banana shape, and they're really stiff. So they don't easily move throughout the blood vessels, and so the organs don't get the oxygen that they need.
Wow, okay. So it's the red blood cell itself that has a different shape when we talk about sickle cell anemia. Right. So why is it that it's predominantly in African Americans?
So in Africa and places where malaria is prevalent, if somebody has one abnormal copy of the gene, so one sickle cell gene, that's known as sickle cell trait. And if you have sickle cell trait, you're less likely to die from malaria. So anywhere where there's malaria, like in Africa, in India, in the Mediterranean, sickle cell disease is prevalent because it's so protective. But in the United States, most people just happen to be of African descent.
Got it. So I have sickle cell trait, and my kids have sickle cell trait. When you have sickle cell trait, because like you said, there's one abnormal gene. What is it that we should be aware of as what would be called a carrier for this disease?
The most important thing to know is when you're ready to have a child, it's important to talk to your partner about whether they may have sickle cell trait or other types of hemoglobin C trait. There's other types. It's not just sickle cell trait that you have to be concerned about. Because every time you have a child with that partner, there's a 25% chance or a 1 in 4 chance that that child will have sickle cell disease. So it's just really important to talk to your doctor about whether you could have sickle cell trait, and if you do have it, get more information about what questions to ask your partner to potentially put you at risk of having a child with sickle cell disease.
Now, all of you out there who are watching Talking with Dr. Donna, that may not be a question you normally ask your partner, like, hey, do you have sickle cell trait? But if you are thinking about having a child with this person, you may really want to take a step back and ask if they also have sickle cell trait. Now, some of you may not even know whether or not you have sickle cell trait, but in California, all babies are tested for sickle cell disease. And so if you were born in the state of California, then your mom or dad should have record of whether or not you have sickle cell trait or sickle cell anemia, which you would probably obviously know. Do you know, Dr. Fitzhugh, is it outside of California that is on the newborn screen, or is it really just in California and maybe some other scattered states?
Yeah, so every state now has newborn screening programs. So most people born after the 1980s or so should know whether they have sickle cell trait or not. But it's still really important to ask because sometimes the information is not communicated. Sometimes the information that's given is not really well understood. So, I have a friend, and actually my husband was diagnosed with sickle cell trait after we got married. So it's still important to think about and talk to your doctor about if you're interested in knowing for sure whether you have sickle cell trait or not.
Great, that's great information. And so how many people are really impacted by sickle cell anemia?
Yeah, so in the United States, there's approximately 100,000 people living with sickle cell disease. But around the world, there's millions of people, especially in sub-Saharan Africa. There's millions of children and adults who have sickle cell disease.
Wow. So if there's so many people across the globe and even in the United States that have sickle cell disease, why is it that it seems like there's not a lot of information out there about it? I know as a physician, I hear stories all of the time about people who come into the emergency room who have sickle cell anemia that are undertreated or poorly treated, or people, even physicians don't know a lot about this disease. Why do you think that is?
Yeah, I think that's the biggest challenge with sickle cell disease. I said earlier that the red blood cells in sickle cell disease aren't delivering oxygen to the organs well. So the way that manifests is the most common complication that patients have is really bad pain. And pain, I think the biggest answer to your question, Dr. Donna, is that there's not enough awareness about sickle cell disease. Some people think you can just look at somebody and tell whether they're having pain or not. I've heard people say, "Oh no, they were watching TV. They were looking fine. That means they're not having pain." But that's one of the ways that patients can manage their pain is by these kind of distraction techniques. Your heart rate doesn't have to be elevated, so it's not something you can just look at a patient and say that person has pain. They also can have other complications, including stroke. They can have kidney disease and liver disease. So it's a very complex disease that a lot of people don't know enough about. And unfortunately, I think the fact that it primarily impacts African Americans in this country, there can be some bias as a result of that as well. So that's one area that the institute that I work for, the National Heart, Lung, and Blood Institute, has studies to really try to increase awareness, to try to decrease some of this mistrust and the way that these patients are being treated, because so many of my patients have the same story.
Yeah. And one of the things that I like to do on this show is to really empower those who are watching this show to get knowledge and to be able to educate themselves, so that when they are somewhere in the emergency room or a family member, they can advocate for themselves. So how do you recommend for people to sort of advocate for themselves if they have a child who has sickle cell and they might be in the emergency room in pain, but no one seems to recognize or appreciate that pain?
Yeah, that's a really important conversation to have with your doctor, starting when you're a child, to really get information and know for yourself what sickle cell disease is. If you have frequent pain, or if someone has frequent pain, it's really good to get a letter from the physician to say, this is what works for me. These are the pain medications that work for me, and to share that information, to really talk to the doctor about sickle cell and how it's impacting you. That increasing the knowledge is so important to be in being an advocate.
Yeah, that's a great piece of advice, to really have that letter. So once again, everyone who's out there, this is why it's important to have a primary doctor, right? Someone who knows you, who is following you, who can help you, so that they know you. They can write this letter that says, hey, these are the pain medications that work for this person. And then you can share it with other doctors, and they can see that you're not just seeking drugs, which is what we get a lot, is that, it doesn't help that, we're predominantly Black folks who get it. and the stigma and the sort of systemic racism that's perpetuated all across this country about Black people being drug addicts. And then when you go into the hospital, and if you can imagine, you're in pain or your child is in pain, and people are telling you that you're not in pain, that might make you a little bit irate. And then you've got yet another stereotype tacked on, which is the angry Black person. So it's a setup for you to not get what you need and not get the help that you need. So it's important to partner with your doctor. That's a great piece of advice, Dr. Fitzhugh. So hopefully all of you out there are taking notes, because Dr. Fitzhugh is dropping knowledge. Okay, so Dr. Fitzhugh, we've talked a lot about what sickle cell is and some of the ways in which it comes out and how people have symptoms of sickle cell. But there's also some cures, right? There's a cure for sickle cell. Can you talk a little bit about cure, and can you cure sickle cell disease?
Sure. That's actually what I work on, trying to help develop a cure that's available for the majority of patients with sickle cell disease. So the exciting thing is that there are a lot of different curative options available now. In the past, the only option that was available was for a child to undergo a bone marrow transplant, meaning you take the bone marrow cells, which are the seeds of the bone marrow, from a sibling who's a complete tissue match, give them to the patient, and those stem cells will make all the different types of blood cells that we need, like red blood cells. I already talked about those, the white blood cells that help to fight infection, and the platelets that help keep you from bleeding too much. So the child would receive high doses of chemotherapy to completely knock out their own blood cells, and then they would get the bone marrow cells from their sibling, and ideally those bone marrow cells would take, and the patient would be free of sickle cell disease, which actually, that approach actually works really well now. So if you have a sibling who's a complete tissue match, the chance that the sickle cell disease will be reversed is about 95%.
Wow.
Right. And so the first problem was that a lot of adults can't tolerate high doses of chemotherapy. So when I first went to the NIH and worked with Dr. Tisdale, we wanted to develop a different approach that could be applied to adults. So rather than giving high doses of chemotherapy, we give drugs to suppress the immune system. So there's two things that we want to happen. We want the bone marrow cells from the sibling to take, so that the sickle cell disease will be reversed. If the patient rejects those cells, that's called graft rejection. And the other thing that we worry about is those cells from the donor or from the sibling can actually recognize the patient as being foreign and attack the patient. That's called graft versus host disease. So we wanted to give drugs that would suppress the immune system so that the patient would take the cells and not have long-term complications. So that approach has been pretty successful. We've transplanted probably about 80 patients, and 85% of them are free of sickle cell disease. And the chance of graft versus host disease is very, very low. So the problem with that approach is less than 15% of patients with sickle cell disease will have a sibling who's a complete tissue match. So what I started doing was working on an approach where patients who have a half-match donor, so a parent or a child or a half-match sibling, can be the donor. So you increase the chance that they have a donor from less than 15% to 90%. The problem is that since the tissues are no longer a complete match, there's a higher chance for graft rejection, and there's a higher chance for graft versus host disease. So the first study that opened in 2009 had a high chance of graft rejection. So we have a new study that opened in 2017 that's been more successful. And it's not just me, it's a lot of doctors around the country who are participating in these half-matched or haploidentical donor trials. So it's been really exciting recently, with more chances of patients being cured of their disease. So that's one type of cure that can be offered, where the donor is someone separate, typically a family member. But there's also even newer approaches now. The first is called gene therapy. So that's where you take the patient's own cells from their bone marrow, and in the lab, they'll put in something called a vector, which transports a normal gene into the stem cell of the patient, of those patient cells. Then they give the patient the chemotherapy, and they give them back to the patient. So ideally, those stem cells that now have the normal gene will grow, and the sickle cell disease will be reversed. So that's one new exciting approach that's taken place. So that's where you are putting the normal gene into the stem cell. But most recently, the fourth type is gene editing, where you use something called CRISPR-Cas or something similar to actually wipe out the abnormal gene and replace it with the normal gene. So again, that's the patient's own bone marrow cells are removed. That's done in the lab where these genes are corrected. And then you give the patient the high dose of chemotherapy, give them the cells back. So there's a lot of different curative approaches now. So this is a really exciting time for treatment of sickle cell disease.
Wow, that is so cool. It is so amazing. As I remember, I have a cousin who has sickle cell anemia, and he was born in 1970, like me. And I remember that they were saying that he wouldn't live to see his 20th birthday, and then he did, and they said not his 30th birthday, and he did, and now we're in our 50s and he's still with us. And so just being able to see through how he's doing, the advances that we're making in sickle cell anemia is just so amazing. Now you talked a lot about trials and clinical trials. And so how, if you have a child or if you're an adult who would like to participate in a clinical trial, now, do we have to come all the way to NIH in DC, or is there a way to participate in clinical trials locally?
So I would say the first thing would be to talk to your doctor to see what trials are available in your area. But there's also a website. It's called clinicaltrials.gov. And you can put it, there's search terms. You can put sickle cell disease, you can put wherever location you are, and it'll tell you all the trials that are available in your area or somewhere nearby. So those are the best ways to find out. And also just go to NHLBI, the National Heart, Lung, and Blood Institute. They have a website where they talk about some of the trials that are ongoing as well.
Wow. Well, Dr. Fitzhugh, this was phenomenal. Thank you so much for all of your information. Thank you for your time. Is there anything else that you would like to tell the audience that I may not have asked you?
Sure. So I would say that there's a lot of hope for people with sickle cell disease that wasn't necessarily available. Dr. Donna talked about her cousin back in the 1970s. There was no real treatments available except to try to give pain medications and fluids and transfusions. The first drug was approved by the FDA in 1998. That's called hydroxyurea. So for a long time, then they only had that one drug, hydroxyurea. But in the last 5 years, there have been 3 other drugs that have been FDA approved: voxelotor, L-glutamine, and crizanlizumab. So, but there's also a lot of trials that are ongoing where they're studying a lot of other different drugs. So I would say there's a lot of hope for the future for sickle cell disease. So just keep your head up.
That's awesome. Isn't she smart, y'all out there? I am a proud big sister. Thank you again, Dr. Fitzhugh, for your time. Thank you for what you're doing, because I've always said that unless there are Black, African American, whatever you want to call us, who are doing the research, that really there's not going to be a whole lot of effort into it. And I know there's a lot of researchers out there who are not African American that are doing research in sickle cell here in the Bay Area and beyond. But it is always really important to understand that as Black folks going into science and research, physicians, like, we're needed, because our areas of interest are usually things that impact our community. So thank you, Dr. Fitzhugh, for being there, for being in those clinical trials, for trying to help us as we're going through these diseases and figuring out like how and what to do. So thank you for your work. I know we're just going to continue to see amazing things from you.
Thank you so much for having me.
Thank you. Thank you. Thank you again, Dr. Fitzhugh. That was amazing. I hope you guys learned something. It was a lot of information, but the one thing that I want to underscore is that she said there is hope, 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 hope. And even though we are not there by any means yet, where we are curing everybody who has sickle cell disease, we are definitely not where we were back in the 70s. We are so far beyond that. So I am thankful that there is hope, that there's progress, that there are people like Dr. Fitzhugh who are devoting their entire careers to working on finding a cure for this disease. So I'm going to clap it up for Dr. Courtney Fitzhugh. Thank you so much again. Thank you so much. You know, she's on East Coast time, so she's like, that's too late. I can't be up that late. But we got her in anyway. So thank you. I wanted just to highlight a couple of things that she talked about and just give you a visual. The first thing is I want to show you the picture of the red blood cells that she talked about. What is the difference between a normal red blood cell and a sickle-shaped red blood cell? So you see the round donut, that is what your red blood cell normally looks like. And again, that's important because that carries oxygen to all of the different parts of your body. And it goes through your blood vessels, which are like tubes. And so you can see that little round donut just kind of flows and floats through without any issue. Whereas the sickle cell red blood cell, that one that looks like a banana, as Dr. Fitzhugh gave such a great visual of it, but that's what that sickle looks like. And that, if you imagine, if that turns over, it can get clogged into those tubes and then block the rest of blood cells to going, which means that wherever that block is, then the pain is downstream from that, right? So if the block is here in my arm, then I'm going to have pain in my lower arm and pain in my hands because those muscles are not able to get any oxygen. So when you think about someone who's what's called sickling or having a sickle crisis, that's what it is that blood cell has been blocked in the tubes and now they cannot get any oxygen to the muscles in the other parts of their body, and that causes significant pain. So that's the first thing I want to underscore. The second I want to underscore is the difference between sickle cell disease and sickle cell trait. So again, we talked with Dr. Fitzhugh about the screening. And just, in 1972, Congress passed the National Sickle-Cell Anemia Control Act in 1975. The first state newborn screening program was developed, and now all babies born in the United States, regardless of their ethnicity, because as Dr. Fitzhugh said, you don't have to be Black, African American, but to be able to have sickle cell disease or to carry sickle cell. So all children are tested that are born in the United States are tested for sickle cell disease. So you will know if you have sickle cell disease or sickle cell trait because the results of your genetic newborn screening will come back, and your parents a copy of that screening is sent by mail to the address that your parents gave, and it's sent to the doctor that your parents said is going to take care of you after you were born. So your pediatrician or whomever family medicine doctor that you may have seen, they also would have a copy of your test. So for all of you mom and dads out there who may have young children and you're not quite sure if they have sickle cell trait, you can always remember the doc that you said your kid was going to go to, and you can maybe try to find it in your own records, okay? So that's how you can look for it. I'm going to pause here and see if there's any questions. I'm not seeing any questions in the chat, except great information and accolades for Dr. Fitzhugh. All right, so then let's move into our need to know. So there are some things that you need to know that's come up this week. We want to talk about COVID because, as usual, we're still in the pandemic. There's still a state of emergency that is in the state of California for COVID. This means it hasn't gone anywhere. And if you want to look at the sort of testing across the United States, then there's where you can see there's pockets of community transmission levels. And this is as of last week. The states that have that high, deep red, those are states where it is very still high rates of COVID. So you see in the South, you see in the Midwest, you see in the East, all of those areas are there really high rates of COVID. The blue areas is the lowest rates of COVID in terms of transmission. But I want to warn you, you see California is a little bit of red, a little bit of orange. And Alameda County is actually a little blip, is a little blue place within the state because we have reported low community levels of transmission. But I want to caution you and all of us, against looking at this and feeling like, oh, hey, pandemic's over, woohoo, because I don't want you to forget where we were just, 8 months ago in the beginning of this year, where we were 2 years ago when the pandemic first hit. We are underreporting our transmission rates. Why? Because this is folks who are going into a laboratory and getting tested. And as you know, we have had rounds upon rounds of free home testing. And when you test at home, you're not sending those results anywhere. So we don't know really what our community transmission levels are if you just look at testing sites. But let's look at the next slide. So we see that our testing rates, again, is low, and that's because, again, they're going to testing sites, not home tests. And I really want you to understand that. We are seeing less hospitalizations, but look, we're still seeing people dying from this disease. So it's not something that you just want to go willy-nilly and forget about. So next, we want to look at what our cases look like. And so if you remember how we were at the beginning of the year, January, we had that high peak of COVID. And now then it went down sort of in early spring, March and April, started to creep up a little bit in the early summer months. And now we're kind of starting to see it level off by testing. But if you look at something called wastewater, right? If you look at the wastewater, that is basically, I know this might be gross, but they take samples of the water in which you poop and they test it and they see, well, do we see COVID in the community there? So I want you to look at the line from the poop of the folks in the community. And that tells you a little bit of a different story. That kind of correlates with what I'm saying, which is that our rates are probably higher than we think because people are testing at home and not sending those results in anywhere. And you can see if you look at that line here on this slide, that line peaked again and earlier this year, went down, and now we're starting to see a little bit of an increase in this early fall. Anticipated that we're going to see an increase in the winter time, and we're going to see a combination probably of COVID more as we get into flu season. So we're continuing to fight this battle, and the way you can fight it the best is by, number 1, getting vaccinated, 2, wearing your mask, and 3, really paying attention to where you're going. So now that you know what these records are here for COVID, the need to know. So number 1 thing that I want you to know this week, our number 1 need to know, is there is another vaccine, right? So there was a vaccine that was approved, and this vaccine has not what's called the mRNA vaccine that we had earlier on, our Moderna and our Pfizer. If you recall, it was a new technology that we used to develop that vaccine. Well, this vaccine has this sort of old technology. It is used as a protein subunit, and it's very similar to vaccines like our diphtheria, tetanus, and pertussis vaccine, or our shingles vaccine. For those who are 50 and older, getting your shingles shot, say that quickly 5 times. That shingles shot has the Novavax vaccine technology. So they took that technology and put it into a new vaccine. It has similar efficacy as the mRNA vaccines in preventing coronavirus infections. And just like the mRNA vaccines, they made special care to not put any eggs, latex, metals, or preservatives, any of those things that might cause you to have an allergic reaction. So if you still are not vaccinated out there and you're saying, well, I don't want to do this new technology vaccine, well, here we go, folks. Here's this new vaccine that is the same old school technology that we've used for many other vaccines that's available to you. So that's the first thing I want people to be aware of. Second thing for our need to know is that there's a new booster vaccine, and it's called a bivalent booster shot. And so what does bivalent means? It means that it doesn't just take care of the original coronavirus strain like our original mRNA vaccines did, but it also now is updated to include the newer variants that we were seeing, the Omicron BA.4 and .5, which was causing so much of the infections earlier this year. So it has the ability to fight the old original coronavirus vaccine, coronavirus infection, as well as the subvariants of the coronavirus. And so we're going to talk in more depth about this booster in the next couple of weeks, but I want you to be aware that it's here. It's available for people who are adults who are able to get the vaccine, and you are eligible if you finished your primary series, okay? So we're going to talk a little bit more about the booster as we get later on, all right? Any questions? I'm trying to read out there. And the flu season's coming. Yes, yes, yes. Yes. All right. So I want you to pay attention and follow us again on all of our handles, on my Instagram page, my Facebook page, because I always share a health tip of the week. And we're talking about monkeypox vaccine and monkeypox and what it is and what it isn't. So we're going to share that tip of the week and make sure that you pay attention and watch it. All right, lastly, I know you guys have been waiting for what? The food of the month. Yes, we're still on that kick here in season 3. We still want you to eat well, have a great diet, because that is so important as we go towards being healthy. So our food of the month for the month of September, a few weeks left in September and a few weeks left of this season. It is, drum roll, watermelon. Watermelon is red. Red, Sickle-Cell Disease Awareness Month, watermelon. What are some of the health benefits of watermelon? So it has antioxidants in it. It can help with your skin. It's rich in vitamin A for your eyes. It gives you vitamin A, B6, vitamin C that helps with your skin, that helps with your immune system. And it just really has a high water content that helps you to kind of flush you out. I don't know if when you eat watermelon, you know you flush. So make sure that you get yourself some watermelon while it's still kind of out there. Go ahead and get these health benefits in for the rest of this month. Add it to your salads, put it as a side, make a smoothie, add it to your water to flavor your water. You can use so many different things. And always, if you do something kind of different or exciting with your watermelon, put it on post it on our sites. Let us know. Let us see what you're doing so that we can, copy it and do something new and different and interesting as well. All right. So that's it. Thank you again for joining tonight. Thank you for being a part of season 3. Remember, you have an appointment every Thursday at 6:30 p.m. You have an appointment with the doctor. Until then, I pray that you stay safe, that you share what you learned tonight with someone, and that you remember that generational health starts with you. So thanks for watching. Until next week, take care. On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna.